Dear friends, welcome to my Geriatric Medicine channel. Today I am going to talk about the heart attack within the cardiovascular system. So, what is the heart attack? What does it exactly mean? Some people say it is the pressure on the heart. Some people say it is due to cholesterol. And there is no clear-cut view about the heart attack in the patient segment. So, let us discuss a few things about heart attack today here. Blood flows to the heart through the three blood vessels, enabling it to function normally. So, heart is full of blood always 24/7 throughout the lifespan. It cannot absorb that blood into its musculature for its function. So, in order to get nutrition for the heart muscles, it needs to get blood from the three coronary blood vessels. These coronary blood vessels, as one grows old, the blood vessels constrict and a good deal of fat is deposited in them, obstructing the flow of the blood and finally resulting in the heart attack. The blood and the cholesterol, the fat and the cholesterol accumulate within the blood wall, within the blood vessels, in its walls, and gets it constricted. Its diameter becomes narrower day by day, and ultimately one fine day it may stop for a full block, and the blood flow will stop, resulting in the heart attack. So, this is about the about how the heart attack occurs in people. There is one special aspect in geriatrics. It is called silent heart attack. You know, the people will have a lot of in middle-aged people will have a lot of chest pain, anxiety, palpitation, perspiration, sweating, and pain in the left hand, and sometimes in the right hand also, in the back, etc. So many symptoms are there for the heart attack to occur. But in old age, there is one situation called silent heart attack. The development of heart attack without chest pain is called silent attack. There is no chest pain at all. Patient won't be aware of the chest pain at all. And so the heart attack will proceed in its way. As one grows older, it is so because as one grows older, nerves become weak. Nerves of the heart becomes weak and ineffective, and the patient loses sensation of pain. Silent heart attack is more common in diabetics. So, diabetics also causes a lot of nerve damage to the heart, nerves of the heart, and old age also causes a lot of damage. Ultimately, the patient may not be aware of the impending heart attack because of absence of pain. So, how do the people know about the heart attack which is going to develop in their body? In any of the following risk factors are there. There are so many risk factors for developing heart attack. So many of they are called the hypertension, which I have discussed earlier, high cholesterol which accumulates in the blood vessels, less life of stress and strain, always thinking of something else which is not going to happen at all in the future, and that causes a lot of strain on the body. It is also a risk factor for developing heart attack. Lack of physical activity. Many old people, because of the arthritis or the backache or the obesity, they won't get up from the chair or the bed and move about for a walk, at least for half an hour a day. They won't. So the lack of physical activity accumulates, uh, is a precipitating factor for heart attack because of so many reasons behind it. Then the family history. If the heart attack cases runs through the families, one may get heart attack in his or her lifetime in old age. Then the overweight, I already stressed on the point obesity. Diabetes. Diabetes causes neuronal damage, nerve damage, damages of the nerves of the heart and elsewhere also. But in this concern, in this aspect, the damages of the heart itself, damages the nerves of the heart actually, it causes, results in absence of pain during heart attack. Then smoking. Smoking is also a very bad habit, and it is a risk factor to develop heart attack. Then how to predict development of heart attack well in advance. So the attack may be prevented by appropriate care. How it is possible? In if above mentioned risk factors, so far I mentioned hypertension, cholesterol, overweight, diabetes, smoking, etc. And then it is advisable that one should undergo treadmill test, where the patient is made to walk slowly and faster and run faster over the machine, which will indicate the stress on the heart during the exercise. That is the treadmill test, which will indicate whether the individual is prone for the development of heart attack or not in future. Friends, which is the best treatment for heart attack, medical or surgical? Patients are always in confusion whether to undergo surgery, whether to have the medicine only, and so many things. So, medical treatment is the best for uncomplicated mild to moderate heart attack. If cardiac catheterization reveals the block of one or two main artery, that is coronary artery I stress on that point, it is the coronary artery that causes the heart pain. If the blockage is there, then angioplasty is the treatment. Angioplasty is the treatment of choice. Recently, one of my patients had been to Bangalore, walking to the tunnel to the platform number 10 to come out to Shumaga. He had breathlessness, he could not walk at all. He had perspiration, no pain at all. And so he sat over the rails or the steps for some time, and the train which he was supposed to catch moved away, and patient could not move or climb a few steps. So he got some help and he got an auto and he went back to the Apollo hospital for the further treatment, where angiogram was done, and it revealed multiple blocks. He said he had 9 blocks. Then coronary bypass surgery was done, and now he is happy and is able to walk briskly also. So, if there is blocks in the coronary artery, blood supply to the particular part of the heart gets decreased or stopped at all, and then patient has to undergo coronary bypass surgery. The symptomatic and functional development and improvement of the elderly survivors of heart surgery is almost uniformly dramatic. So, that is the uh, importance of bypass surgery. It is called CABG, coronary artery bypass grafting. That grafting is done by selecting a few beautiful healthy veins from the legs and taking it out, connecting one end to the aorta and the other end to the healthy part of the coronary artery, bypassing the obstructions. That is called CABG or coronary artery bypass surgery. Friends, this is in a nutshell about the heart attack, and if the information is useful to you, go through the entire channel. If it is useful to you, share it, like it, subscribe it, and anticipate for the further episodes of channel. Until then, thank you and Jai Bharat, Jai Karnataka.